Hello everyone, my name is Lalit and I'm from MTech DCS batch from IITJ. Here I wanted to present my project which is AR/VR based medical instrument manual. So let's proceed with it. I'm going to present the slide presentation. The agenda of this project presentation is to explain you all about the medical instrument manual using AR/VR and how it is going to help the novice user and surgeons of hospital, and also the hospital and medical research center, how it is going to help to reduce the cost and make use of existing their medical instruments better way and to the fullest capacity. So medical devices are costly to purchase and it is difficult to carry these devices for demos on the site, and with just presenting the videos or slides of the medical instrument, it does not give comfort and confidence to user to purchase it. To solve this problem actually with AR based user manual, since user is experiencing the use of instrument at real time, it will accelerate the sales of a medical instrument, and this will widely will get used in future definitely. The problem statement which we are going to address here is like the medical instruments equipments and devices are costly. The newly invented created medical devices can be utilized to its fullest capacity, and surgeons can save time, effort, and time of treating the patient and can improve the accuracy only if surgeon is completely familiar and comfortable to use the device. The medical instrument demos are arranged on the site through videos and slides currently. To make medical instrument available to the site for demo, it utilizes lots of resources and accumulates the cost as well. And with just presenting the videos or slides of a medical instrument, it does not give user comfort and confidence to purchase it, obviously, because if user does not know that how they are going to work with respect to that particular medical instrument and how it is going to be beneficial for them, to reduce the time, efforts, improve accuracy, so they won't be using it. They will go on using their normal instruments and generic traditional method to perform any surgeries. So using this AR/VR based user manual, what we are developing is like the surgeon can use a simulator, and the surgeon can operate a simulator. Using a simulator, surgeon can perform the task. Uh, so whatever the medical instrument is, let's say suppose a catheter we wanted to design. So a catheter, if we want to design, then surgeon can operate a catheter using AR technologies in augmented world actually, wherein like we would be displaying the guiding message to surgeon, that what key need to be pressed to perform the demo. Similarly, we will be guiding him through the sound input as well, and we obviously will be keeping this whatever the surgeon perceives response into the system. And that's how we are going to keep a record of, and it will improve uh, improve confidence of surgeon, since the surgeon, if he or she is a novice user or a novice surgeon who actually wanted to perform surgeries or wanted to use the catheter, so he or she can perform this AR/VR demo anywhere and can practice it more, so that he or she can improve accuracy, and it will also give confidence to perform the same task when it comes to live environment. So key features of this particular manual which we are going to design is like it will be displaying you the key aspects of any product on the screen, on the layout. If you can see here is like we are capturing the data of a patient, and like advanced catheter we are showing on the screen, uh, wherein we are capturing the port number, irrigation port number for the catheter, and we will be also monitoring patient health as well. Those inputs we wanted to add into. But how this manual will work, that also will be guided using a guiding messages. You can see on the right of this image, wherein we are giving a guiding messages where to pull back this particular tube. So since we are performing this close to real time, it will give novice users confidence to use this catheter. So let's move to how it will be useful when it comes to a real world, how it will be useful. So first point is like non long-term memory retention. So it has been observed that content studied via AR is retained longer than the one studied from traditional methods. If two people, if we will consider for the study, one side where the candidates taught through the AR medium against printed media on the other hand, the retention of the same content was tested after a week. It was observed that the people with the technology had longer retention of the subject. On the other hand, no significant difference was seen in short-term memory. The second point is like improved physical task performance. Experiments have shown that in medical, the candidates who were subjected to AR-based learnings were better to perform the physical task in surgery. This is because they are better able to transfer the learnings to the actual cadavers. Also, the task was performed with higher accuracy. Obviously, it comes if it comes to the surgeons also in the hospitals. If they are able to perform certain tasks using the medical instrument uh, manual demo, then they will obviously be able to perform the same thing in the operation theaters as well. The third point is reducing teaching hours. Experiments have shown that in medical, the candidates who were subjected to AR-based learnings were better able to perform the physical task in surgery. This is because they are better to transfer the learnings to the actual cadavers. The duplication of effort, why I have mentioned here is like whenever any person or robots or anything can give a surgeon a demo or transfer a knowledge, that will be a repetitive task obviously for the surgeons or the novice users or caregivers are joining in. They need to provide continuously them a knowledge transfer or give them how the device works and everything. In case if we have this kind of a AR VR based manual in hospital or medical research center, we can provide them this manual and they can do it on their own and gain the knowledge. So that will save our duplication of efforts. The possible problems with respect to the AR VR, which is already studied and identified, are the photosensitive epilepsy, mm, which is seen, and the habitual usage, the second point actually, with respect to usage, and discomfort, injuries, collision, falls, and cyber sickness. These are actually the common problems were identified. So cyber sickness, I would explain from the down, like the most the most commonly reported negative side effect of AR/VR is motion sickness, often accompanied by dizziness and in some cases by headaches and fatigue. Collision and fall means like AR/VR users and especially the VR users are frequently unable to see or are distracted from noticing some or all of their physical surroundings. So discomfort and injury while using, if they are around some objects, then there is a possibility to collide and they can fall. That is what the discomfort and injury and collision and falls. So if you use any video devices or AR VR, so obviously you will get used to it, and that is what the habitual usage is. There are risks associated with the use of AR VR that have already been identified because the technology has not been in widespread use until relatively recently. The nature of this risk is not fully understood, and it is likely that other not as yet identified risks will emerge. The risk may be magnified to the clinical applications. So these are the problems. So future plan of work for me, since I have interest in AR VR, is like from the catheter navigation and force evaluation. The error could hold in about 10%. Future work is to add some functions in VR model such as rotation, collision, warnings, and import the decom images into the VR system to get patients blood vessel model. So I will try to do it. The overall summary of the project is like using AR VR we can design very user friendly real time medical devices manuals which will accelerate the sales of the product of a company. However, there is more to learn about the risk and benefits of AR VR, obviously, about how to calculate the way those risks and benefits for different devices, software applications, and populations, and about how best to communicate guidance, warnings, and other information to surgeons, practitioners, and caregivers. These questions obviously all merit careful study and consideration. So I will keep on doing my research, keep on working on the aspects of AR VR, and I wanted to explore on many things about it. So I have like 3 4 months of time. So I would be doing my research and will be investing more time to complete this project. Thank you all for your time.